Welcome to week 2 of Women's Wellness Wednesdays. This Golden Valley Health Center's project is funded in partnership with EMC Health Foundation. Remember, you can win a great Women's Wellness swag bag by sharing this content and tagging a woman you care about. Welcome to your 20s. Let's talk about how to help you live your healthiest life. The information provided in the slides is adapted from the Department of Health and Human Services Office on Women's Health. Not all of the information may apply to your life. Golden Valley Health Center's providers are available to help you get personalized health care. Call or text us at 866-682-4842 to schedule an appointment today. Let's talk about the things you can do each day to keep yourself healthy. You can choose to focus on one thing each day or work toward doing all of these steps. Eat healthy. Use the MyPlate plan to get started. Go to choosemyplate.gov for more information. Get at least 30 minutes of physical activity each day and at least 7 to 9 hours of sleep each night. Reach and maintain a healthy weight. Get help to quit or not start smoking. Limit alcohol use to 1 drink or less. Don't use illegal drugs or misuse prescription drugs. Take 400 to 800 micrograms of folic acid. Wear a helmet when riding a bike and wear protective gear for sports. Wear a seatbelt in cars and not text and drive. There's a lot that you can do to keep yourself sexually healthy at any age. Limiting the number of sexual partners and using a condom each time they have sex are 2 great ways people help protect their sexual health. Now let's talk about info that may be important for you to talk about with your provider at your next Well Woman visit. A Well Woman visit is a yearly preventive checkup, and it's a time to check in on how you're doing, how you'd like to be doing, and what changes you can make to reach your health goals. Talk about whether you plan to get pregnant in the next year or the right birth control method for you. Talk about your weight, diet, and physical activity level. Talk about whether you use tobacco, alcohol, or drugs. Talk about any violence in your life. Talk about depression and any other mental health concerns. Talk about how you can protect yourself from the sun and the hazards of tanning. Talk about your family health history, especially a history of cancer, heart disease, and diabetes. Also, talk about your unique story and all the things that make you, you. At your next Well Woman visit, your provider may recommend the following tests, medications, or vaccines for you. The decision to get any medical test or procedure at any age is a personal one between you and your doctor, and these recommendations may not apply to every woman. You may be recommended to have your blood pressure checked, get a PAP if you're 21 or older. It's also great for each person to get at least 1 HIV test during their life. Your provider may also recommend STD or sexually transmitted disease testing for you. Your provider may recommend that you take folic acid if you plan to become pregnant. Also, if you have any chronic health conditions, your provider may recommend certain medications to help you manage them. You also may be due for certain vaccines based on your age and your previous vaccine history, such as flu, chickenpox, hepatitis A and B, HPV, meningitis, tetanus, diphtheria, and whooping cough. If you're pregnant, prenatal care can also be a Well Woman visit. There are certain tests during pregnancy that your provider may recommend to check your and your baby's health. Check out our other videos this week for women of all ages. Remember, you can win a great Women's Wellness swag bag by sharing this content and tagging a woman you care about. Schedule your appointment today by calling or texting 866-682-4842, and thanks again to our partners at EMC Health Foundation.